Opening a drug rehab in Massachusetts means stepping into a crisis. 515 confirmed overdose deaths in the first quarter of 2023 alone, and not enough licensed facilities to meet demand. Charles River Recovery's 2023 statistics recorded 515 confirmed overdose deaths in the first quarter alone, the gap in care you would be opening to fill. How to open a drug rehab in Massachusetts. Here is the startup path for entrepreneurs and operators: licensing, steps, and compliance. We cover why Massachusetts, the core components, the step-by-step path, BSAS licensing, and the compliance essentials. In Massachusetts, drug rehabs are classified as substance-related disorder treatment programs under the state's behavioral health regulations. These programs provide detoxification, residential treatment, outpatient services, and aftercare, filling critical gaps in a state hit hard by opioids. Fentanyl has contributed to over 85% of overdose deaths in recent years, per the Massachusetts Drug Addiction Statistics cited in this guide. In Massachusetts, every addiction treatment center must be licensed by the Department of Public Health's Bureau of Substance Addiction Services before admitting a single patient. The licensing process can take up to 6 months from application submission, months of overhead before you can open the doors. You must also pass an on-site inspection within 6 months of submitting your application, on top of public health and zoning approvals. This guide points to Behave Health for integrated EHR systems tailored specifically for behavioral health service providers, the systems and new Massachusetts facility needs from day one. Behave Health offers EHR, CRM, and RCM solutions designed specifically for behavioral health providers to streamline the administrative work behind a new facility. Secure electronic health records are a checklist item for opening. Behave Health's platform is designed to support that documentation directly. 6 steps take a Massachusetts rehab from idea to open doors. Miss the order, and you stall at licensing or financing. Market research, financing, location, BSAS licensing, staffing, and compliance. Let us walk through each one. Step 1. Assess local demand before you commit capital. Check whether enough facilities already serve your target area and the prevalence of substance use disorders in your chosen location. Confirm you can sustain operations while building up clientele. Then capture it all in a detailed business plan for financing. Step 2. Fund the project and choose a compliant site. Apply for loans or grants and seek investors if necessary, guided by the ROI in your business plan. Choose a location that complies with zoning laws and sits close to hospitals and other healthcare providers. Step 3. Apply through BSAS and complete the required inspections. The application requires a letter of intent and a written plan of professional services. You also submit public health and zoning approvals and proof of liability insurance, then pass an on-site inspection. Step 4. Build the team your license and your patients require. Hire a medical director, licensed counselors, and administrative personnel to run the program. Facilities treating opioid use disorder are generally expected to offer FDA-approved medications, such as methadone or buprenorphine. Step 5. Define the services your facility will deliver. Build out detoxification services, residential inpatient care, and outpatient programs to cover the continuum of care. Pair medication-assisted treatment with counseling services, the evidence-based combination this guide highlights. Step 6. Fill the beds and hold the line on compliance. Build partnerships with local healthcare providers and invest in digital marketing to reach the patients who need you. Adhere to HIPAA regulations and maintain proper documentation for audits continuously. This guide's compliance checklist gives a new Massachusetts facility its non-negotiables. Obtain your BSAS license, secure proper zoning approvals, and pass all fire safety inspections before you open. Implement a secure electronic health record system and train your staff on HIPAA compliance. Establish clear billing procedures, maintain liability insurance, and regularly audit internal processes. Behave Health offers integrated EHR, CRM, and RCM solutions designed specifically for behavioral health providers, built to streamline the administrative processes behind opening in Massachusetts. An integrated EHR tailored to behavioral health service providers, designed to support the secure records your compliance checklist requires. CRM and RCM in the same platform, designed to streamline admissions, marketing follow-up, and billing as you scale. Behave Health tracks the trends shaping treatment, expanded telehealth and medication-assisted treatment, so your systems keep pace. Stop guessing your way through Massachusetts licensing and setup. Book a 20-minute demo of the behavioral health platform at behavehealth.com. See the EHR, CRM, and RCM built for new behavioral health facilities at behavehealth.com.